According to the CDC, someone in the U.S. dies of a stroke every 3 minutes and 14 seconds. Knowing the signs and also when to get help can really mean the difference between life and death. Joining us to talk about this now is Dr. Sohel Ahmed. He's the medical director of the Stroke Center for Cook County Health. Doctor, thanks for being with us.
My pleasure. Good afternoon.
It's such an important topic. According to the World Health Organization, stroke is the #2 leading cause of death worldwide. I know it also is a leading cause of disability. So what are some of the signs that we need to look for?
So the signs and symptoms for like a stroke are few actually, and we address this in our community as a mnemonic that I will go over, is be fast, which is sudden balance problems. Patients with sudden unilateral one eye or both eyes vision loss. FAST stands for, and which is very important, is F for face, that is sudden droopy face. A for arm drooping, if the arm is drifting down. S stands for speech, that is sudden inability to speak or understand the speech. And T is time. So time is of extreme essence, as we know that every second, several thousands of neurons, those are brain cells, they die because of the stroke. So call 911, that is the T, that is the time, as soon as any of these symptoms are experienced by anyone.
Great reminder. It's also important to point out that strokes can happen at any age, and I think that surprises some people.
It absolutely does. Any person of any age can suffer a stroke, definitely elderly and certain demographics are affected by this more than others. So these symptoms and recognizing these like signs are like extremely important to take immediate like next steps. The first thing is starts with recognizing these symptoms, and second is taking these patients to the ER as soon as possible.
Great. And in terms of prevention, is there anything that we should do day to day or think about day to day to keep us healthy?
So that actually brings us to the risk factors. So what are the stroke risk factors? High blood pressure, diabetes, high cholesterol, and certain lifestyle indicators, which are obesity, physical inactivity. Smoking is a big one, and certain heart conditions in which irregular heart rate puts the patients at risk of more blood clots and strokes, that is called atrial fibrillation. Addressing these like problems by controlling the risk factors of like the stroke plays significant role in actually preventing these.
Dr. Ahmed with Cook County Health, life-saving information. Thank you so much for your time today.